Hello, Sarah here from the Centre for Mental Health. I hope all is well. This is just going to be a short video about what's going to happen in the next couple of days. So obviously we are going to get a new Prime Minister. This is big news. Well, it's not big news, but it's significant news. And I guess we don't really know who is going to be Prime Minister yet, but we kind of do. And I wanted to basically kind of send a message to the new Prime Minister about mental health policy. And the reason for that is because we really don't want a rollback in terms of focus on mental health policy going forward. We have seen significant progress in the last 5 years, I think, in a way that in the 30 years I've worked in mental health, we certainly haven't seen. And, you know, we all have an anxiety, people like me who've been around for a long time, that it's still quite fragile, that something can come along and knock us off our perch. And Brexit has done a bit of that, and of course there's lots of national policy out there that is significantly important. And so we in the mental health space really kind of want to hold on to momentum and make sure that the new Prime Minister really understands the impact that losing sight of mental health will have on all government policy. For those of you who don't know, the Centre for Mental Health is part of a group called the Mental Health Policy Group, which is a coalition of organisations that include Mind, Rethink, Royal College of Psychiatry, the NHS Mental Health Network from the NHS Confederation, and the Mental Health Foundation. And we really come together as a group of organisations to kind of agree on some of the big things that we like to influence in terms of government policy. And we've been meeting for a number of years to do that. So we recognise collectively the significant progress that has been made, certainly with the 5-year forward view, and we now have data and evidence about investment and access into mental health services. We've seen a huge ring-fenced investment into the NHS long-term plan that cannot and must not be underestimated. And we have seen the much-awaited review of the Mental Health Act. So without really undermining any of those huge and really important kind of successes, we mustn't lose sight of the things that still need attention or that need kind of further attention. So what we already know is that, you know, 4 out of 10 people who need help are getting the help that they need. So we're not even halfway there yet. There is so much more to be done. We know that there is a significant increase in health inequality and a sense of kind of anxiety about what we can do about that. There is a huge kind of frustration about social care, and how do we prioritise that when we're only kind of really thinking about kind of clinical NHS based services. We also worry about prevention. We are yet to see the prevention green paper. So with all of that said, the Mental Health Policy Group have recommended the Prime Minister really focus on 5 things. And of course, anybody who knows me will know that I've got another 5 in my back pocket, and I'll come back to those at the end. But just to talk about the policy group manifesto first. And I guess that the first thing is prevention. You know, we really can't keep looking at the other end of the telescope and thinking about when it's too late for people. We know that emotional literacy can really make a difference. We really know that giving people the tools at the earliest opportunity about recognising and understanding their emotional well-being is really important. We also know for really serious things like school exclusions, for knife crime, youth violence, a prevention agenda really is the thing that will make the biggest difference. So we really urge the Prime Minister to focus on that and to take the Prevention Green Paper as a kind of, you know, central to what they do going forward. We also would like the government to absolutely see through the recommendations that were made through the Mental Health Act review. you know, some of those recommendations are extraordinary, and they hand over autonomy to individuals in a way that no other review or piece of work of this kind has ever done before. We really think that the recommendations are clear, they do require investment, and we would urge the government to make that happen. We also want the government, and this is kind of a no-brainer really, to have a cross-government approach to mental health. We really need that lens that looks at everything really. So housing policy, welfare policy, social care policy, even kind of planning in terms of local areas. If we had a mental health lens, imagine the difference it could make across the board. And so we think that the government would be well placed to start doing that work now. We have a lot of the evidence at hand that could tell us what we need to do. We also really want to make sure that people really, you know, they get the help at the time that they need it. And so, you know, I kind of sometimes hold my head in my hands when I hear from people about the long waits they have in terms of accessing help. I hear from people in terms of accessing help in crisis. And I kind of, you know, we can't downplay the importance of that. The people that I've spoken to who've needed help and haven't been able to get it, it's kind of damaged their ability to ask for help a second time. So access to services must and should be a priority going forward. And finally, the Mental Health Policy Group really kind of want to urge the government to focus on developing a workforce that is fit for the future. So a mental health workforce that is fit for the future. And that means really thinking about what do people need to be inspired to take up these roles. Also, what do people need in terms of training for these roles? And this very much starts at kind of, you know, the point of education, early days. I really knew that I wanted to be a social worker from about 14 years old. And that was because I had a really great vocational careers teacher at school. But, you know, I don't think many people have that opportunity to really think about what they want to do and be inspired. And I think we also have lots of issues in terms of the mental health workforce. You know, it's a difficult job. You know, pay isn't always at the standard that we think it should be. And all of those things, all of those factors come together and create a perfect storm in terms of, you know, the worries that we have about the workforce going forward. So we really need the government to kind of really hone in on how we make improvements to that and fill the gaps that we already have. But the Centre for Mental Health also has some really important messages for the new Prime Minister, and we would really love to help them think about mental health going forward. And these are some of the things that we think are really important. So in extension to the cross-government approach to mental health, we really want the government to focus on inequalities. Now, Theresa May very clearly said on her first day in office that she wanted to deal with the burning injustices that she saw in the UK, and those injustices are still very much present, and we really feel that the new government must attend to those. When I'm talking about health inequality, I'm talking about the impact that poverty, poor housing, you know, exclusion from schools, all of these things have on an individual's ability to stay mentally well throughout their life course. Let's face it, we are not in a situation in the UK where we can safely say that poverty isn't having the most horrendous impact on communities, on individuals, and we mustn't turn a blind eye. So the new government really would spend a huge amount of time well if they were to focus on this. We also think that suicide prevention as a kind of aim in of itself is really important, and the reality is that we really need the government to who've made many commitments. So, you know, the investment into zero suicide, of course, really, really important, and we absolutely don't want to undermine or underestimate that. But make no mistake, there is more to it. And so we really want the government to really think about their suicide prevention plans and really work closely with stakeholders about actually what that's about. And so we were pleased to see the first appointed suicide prevention minister, but we want that minister to be given all the power that they need to make positive change going forward. We also really feel that it's very important that we mustn't forget those in the criminal justice system. And we talk a lot at the centre about the impact of multiple disadvantage, you know, extreme vulnerability. And the fact is that the majority of people in our prisons are people who come from a place of trauma, who come from a place of where they have never been given the help that they need at the right time. And so we really want the government to kind of think about the criminal justice pathway and all of the recommendations that have been made through the Bradley report and many others, Revolving Doors, the short-sighted report in terms of, or campaign to reduce short sentences. All of these things must come together and form kind of priorities for government. We also make a plea that the government really focus on an asset-based approach to the digital lives of children and young people. What we've seen very much from the government approach so far has been a deficit kind of model, a way of thinking that really thinks about the kind of digital landscape as the kind of monster over the mountain. And we really want to urge the government to think about it as an asset, to think about how we can create digital lives for children that are safe, that enhance and amplify self-help, that really help people find others that can support them. So, you know, it's a kind of shift in the way that we're asking them to think, but nonetheless, you know, this could make all the difference going forward. There are so many things I would like to say to the new Prime Minister, and hope I will get the chance to at some point. Yeah, if you get the chance to say something to your MP or to your councillor, please have a look at our website and look at our prevention, our vision for prevention that's supporting the Green Paper going forward, and do look at the policy group manifesto. Yes, please do keep in touch, and we look forward to hearing from you. Have a good week.